I'm Amy Daniels, Project Manager for Spark. Today we are privileged to have Kathy Koenig with us to speak about challenges with diagnosis and intervention for girls and women. Kathy is an Associate Research Scientist at the Yale Child Study Center. She has been involved in research and clinical work in children with autism for 20 years. She has lectured and published on gender differences in autism spectrum disorder and also on the growth trajectory of girls who are diagnosed with ASD. In 2013, Kathy founded the Initiative for Girls and Women with Autism Spectrum Disorder at Yale. This program is designed to address communication and socialization differences between males and females with autism. It achieves its goal through recreational and communal activities. These activities allow girls and women to pursue their interests and leisure activities in a safe and supportive environment. It is our extreme pleasure to have Kathy with us today. So without further ado, Kathy, please take it away.
Thank you, Amy, and thank you, Vincent, for that introduction. I am really excited to be able to speak today. I'm honored to speak, actually, and I'm eager to understand what questions you have and to respond to those questions. I hope that this information is going to be helpful to everybody. So for today's webinar, what I was hoping is that I would be able to convey to you what I think the complexities have been and continue to be with regard to diagnosing girls and women on the spectrum. I will talk a little bit about biological differences, but more behavioral differences between girls, typically developing girls, and girls with autism spectrum disorder, and how these behavioral differences translate into the kinds of things that we see when we're working with these girls. I'll talk about challenges that I think are specific to girls and women, and I'll talk about available interventions and try to describe how we might be able to customize those interventions to better fit girls and women on the spectrum. So just to review, autism spectrum disorders, currently the diagnosis is made when an individual has impairment in social communication and also restricted and repetitive behaviors. So when I think of impairment in social communication, what I think about is not just maybe a delay in language or deviant language, but what I think about is children who don't understand the power of social communication, the reasons why it makes sense to communicate, the reasons why communicating with other people will make your life easier, and that individuals with impairment in social communication, often they don't understand how the social world works, and that makes it difficult for them to function in the world. I also think of restricted and repetitive behaviors as possibly being related to individuals trying to soothe themselves or establish a secure world for themselves. Sometimes our individuals with autism spectrum disorders feel very disorganized when they deal with novelty, and they adapt rigidity and routines and sometimes stereotypic behavior to help them feel more secure. So we can talk more about impairment in social communication and restricted and repetitive behaviors in girls. But just to take us back a little bit, in 2013, the Interagency Autism Coordinating Committee, which is an NIH committee made up of experts from different institutes within the NIH who are concerned with autism, issued this statement. Basically, they were describing that we need to really be much more careful about diagnosing autism spectrum disorders in girls and women, potentially because there might be differences in the way girls present. Perhaps girls are less disruptive, for example, at school or at home, and maybe girls have a better ability to mask their symptoms. This was exciting to me because it was finally a recognition that, yes, there are girls out there who are underdiagnosed, and these girls need intervention, of course, every bit as much as boys. And this means that the NIH will direct money towards research into girls and women with autism spectrum disorders. And in fact, that has happened. When NIH is now requesting proposals for research, they often are highlighting the need for researchers to consider girls. In addition to the NIH statement, the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, put this caveat within their narrative description of autism spectrum disorders, suggesting that girls without intellectual impairments or language delays who are on the spectrum might go unrecognized because of subtler manifestations of social and communication difficulties. This, to me, was also very exciting. I was glad to see this kind of recognition because it will highlight this diagnostic challenge for clinicians and researchers. So the next thing I wanted to basically speak about is whether diagnostic criteria right now are based on a male prototype. So often in the media, we see portrayals of individuals with autism or what used to be called Asperger's syndrome or high-functioning autism, and these folks are men. And so basically when clinicians are learning how to diagnose autism, they gain a knowledge base, but then they also have to gain an experience base. They have to figure out how to diagnose autism based on what they know and what they've seen before. If most portrayals in the media are based on a male prototype, and in fact, if most clinics see more boys than girls, a lot of clinicians end up perhaps looking at the diagnosis of autism through the lens of how boys appear. So that, I think that becomes complicated for clinicians who are trying to understand how to diagnose girls who may be on the spectrum. In addition, I think an important point for clinicians and for families to understand is that it's less important to compare a girl suspected of having autism to what boys with autism look like. I would rather see a clinician compare a girl suspected of having autism or an affected girl to that girl's same age peers. And this is because boys and girls, men and women act differently. And I think we all know that from day-to-day life. And in fact, this is borne out by research as well. Men and women act differently. They behave differently in response to different environmental issues or in terms of family issues. And what the research tells us is that sex differences exist in socialization, communication, and behavior, starting with babies and going all the way up through the developmental stages, toddler, preschooler, school-age child, teenager, young adult, older adult. Sex differences exist. So just to give you a couple of examples, and this is well researched, for babies, on average, boy babies are harder to soothe than girl babies. Male babies have a harder time learning how to soothe themselves than girl babies. And I don't mean one baby in comparison to one other baby. I mean on average in terms of groups. Another difference that's noted in toddlers, preschoolers, and even school-age children is that boys are much more likely to engage in rough and tumble play compared to girls. Not to say that girls aren't interested in kind of that rough and tumble physical contact, just simply to say that boys do it more. And these behavior differences are rooted in brain and biology, and I think that's important to stress. So, for example, in the past, people would always think, well, you know, the boys act like boys, they like rough and tumble play because that's kind of what they learn from their family and other boys. True to some degree, but actually that kind of propensity for rough and tumble play, that's biologically rooted. So anyway, I'm going to take you through some sex differences that exist in typically developing children, and then I'm going to talk about how this might make a difference for girls who have an autism spectrum disorder. So for example, with regard to socialization, girls show an early advantage in face recognition skills, just the ability to recognize somebody's identity. Girls show an early advantage in emotion recognition. They're better able to recognize and read emotions than boys. And girls show a better ability early on to recognize other people's distress. This isn't to say that boys don't develop these skills, they do, but girls are a little bit better at it early on. Now, if you think about these three issues, face recognition, emotion recognition, and recognition of others' distress, you may know that in children with autism, we see difficulties with face recognition. We see difficulties with emotion recognition. And children with autism are less likely to recognize another's distress and respond to it. So you may have the experience of working with a child with autism, or you may have a child with autism who, as a young child, might laugh when another child was crying. And this isn't because necessarily that's so funny, but the child with autism doesn't truly recognize the distress of the crying child. So the question that's outstanding here is that if typically developing girls have a little bit of an advantage than typically developing boys, do girls who have some autism features have a little bit of advantage compared to boys with autism features? Are they less impaired in these particular realms, still impaired but less impaired? And the question is, what is the gap in terms of socialization skills between girls diagnosed with autism and typically developing girls? In terms of communication, there are also gender differences. So, for example, what we call display rules for emotion are the rules that society conveys to us about how people can display emotion. So in our society, in this particular society, anger is much more accepted if boys and men express it. It is much less accepted if girls and women express it. So girls and women very early on learn not to show anger when they feel it. And studies have been done to show that girls and women show anger at the same levels of intensity as boys and men, but they actually are better at containing how they feel. Girls actually show early on more pro-social behavior than boys. They're more likely to reach out and to help other kids than boys early on. Girls are better at recognizing nonverbal cues. So I'm not saying that these things, like pro-social behavior, are necessarily biologically determined. I think they are to some degree, but some of these things are also imposed by our environment. So again, if you're thinking about children with autism, it may be the case that a boy with autism is more likely to act out behaviorally if he is angry. It is conceivable that a girl with autism, particularly a young girl with autism, has learned that although she's angry, she better contain her behavior. So there are these complex interplays between possibly societal constraints and biological behavior that might change the way a girl with autism communicates their distress. Also with regard to showing empathy, typically developing girls show more empathy early on than typically developing boys. Girls have a little bit of an advantage with regard to taking the perspective of another, understanding others' perspective early on in life. I mean, that skill for understanding what other people are thinking and feeling, that comes online about 3.5 to 4, or between 3 and 4 in typically developing children. I think we may know that children with autism often have difficulty with this perspective. But again, if typically developing girls have a little bit of an advantage along this line, do girls with autism have a little bit of an advantage? And do they look less impaired with regard to taking the perspective of another compared to boys with autism? Typically developing girls are more likely to socialize in dyads, just 2 girls together, than in larger groups. Whereas for boys during preschool years and school-age years, socialization is more often in a group. It's more loosely organized. I've read some work that suggests that if a girl with autism is socializing exclusively with just another little girl her age, there may be some ability of the more typical peer to be a little bit more forgiving and a little bit more accommodating in one-to-one play. And that might mean that a girl who has some vulnerabilities in terms of autism symptoms isn't picked up, isn't noticed, because they seem to be doing okay in that one-to-one play. The other thing is that typically developing girls usually have more language-based play than boys of the same age. This could be hard for a girl with autism, and that's where you might find them struggling a little bit. I want to talk about a phenomenon that I've seen in my work here at the Yale Child Study Center Clinic, Developmental Disabilities Clinic. I want to talk about what was coined as sociolalia by my friend Els Bilshuis in the Netherlands, who's a psychologist interested in understanding girls. And what we talked about together, and I've talked about this with other psychologists and nurse clinicians and other professionals, is sometimes with girls with autism, we see mimicry of salient gender-normative behaviors. So typically developing girls may be interested in dressing up. You know, they may be interested in being dressing up like a princess or whatever. And what I've seen in some preschoolers, toddlers and preschool girls with autism and even early school age, is sort of a clinging to this kind of dressing up that is far more extreme than you might see with a typically developing little girl. And in some ways, what Dr. Bilshuis and I have spoken about and thought about is that these girls notice early on that they aren't quite connecting. They don't quite understand what's happening in the social world, but they have been able to glean that girls their age like to dress up and like to do particular social scripts related to dress up. And they may really cling to this kind of behavior in a way that camouflages their real difficulty in understanding the social world of preschool and early elementary school. There's an idea that they may kind of hide out and you might not notice because this behavior might look pretty typical. You think, well, little girls like to do this. But what we notice is that this behavior is an extreme. In another realm, imaginative play is important. So sometimes with girls with autism, what I see is an obsessive interest in recreating the same scripts over and over. So what looks like imaginative play, creative play, is actually just a repetition of the same kind of play scenario that they've seen over and over again. And this can be confusing for a clinician who's not really attuned to it, because you may see a little girl or parents may describe that there isn't a lot of imaginative play going on. But when you really probe, what you find is that it's simply a script that's played again and again and again. So I want to move on to restricted and repetitive behaviors, because we see this in children with autism, males and females. And what I've learned through my clinical work here at the Child Study Center is that both boys and girls on the spectrum do have restricted and repetitive behaviors. But what I've noticed is that for boys, the unusual interests seem more pronounced for boys. So I have encountered boys who are extremely interested in elevators, deep fat fryers, train schedules, or electric fans. And these obviously seem odd to children who interact with these boys. I've seen girls here through our clinic and through my clinical work who are very interested, obsessively interested in a particular topic. But the topic itself is not so unusual. So perhaps a girl is interested in Disney princesses, or perhaps a girl is interested in horses. These are interests that any child could have, so it doesn't seem so unusual. What becomes unusual is the quality of the interest. Is the interest obsessional? Is it difficult to get the child to talk about anything else? Is the child interested, for example, with regard to Disney princesses or Barbie or American Girl? Are they interested in discussion and expanding their play and conversation around these topics, or do they just stick with the same thing over and over again. I think this can be hard for clinicians to sort out because some of these things seem very typical. And I think that one way to think about it is to ask yourself, how interfering is this behavior? I mean, if you have a boy who every time he enters an office building has to run to the elevator and go up and down many, many times while he examines the elevator, that can be very, very interfering. If you have a girl who wants to read American Girl books, that's not so interfering unless it becomes obsessive. And so I think for clinicians and for families, that's how you have to think about it. So the next question I wanted to address is, when are differences between the sexes noted, or between girls with autism and typically developing girls? And what some research has borne out is that some differences are not as pronounced until girls begin to enter middle school and high school. And I'm going to describe more about that as I move on, but suffice it to say that girls and boys have very different socialization patterns, and typically developing girls, as they move into middle school and high school, have a different way of socializing than typically developing boys. So girls, typically developing girls in middle school and high school, start to socialize more and discuss more feelings and emotions and relationships. And when this starts to happen in maybe later elementary, middle, and high school, this kind of conversation can be very confusing for a girl who's on the spectrum. And I'm going to say more about that. So next I want to try to address what I think are the unique challenges that families and school districts face, teachers face, educators, when they're thinking about girls with autism spectrum disorders. There are a number of different issues that are going to be different for girls than for boys, and consequently intervention is going to have to be different. So the first is grooming and dress. Of course, as little girls get older and move through elementary school, most girls become more aware of how they're dressing. And many girls, not all, but many girls start to think about how they're dressing and the ways in which they're kind of developing a personal style. And if you have a daughter who has gone through middle school and high school, you might appreciate that this can be a time of great angst, trying to figure out what clothes do I want to wear, how, do I want to wear makeup, how do I want to wear my hair. This kind of stuff is really fraught for all girls as they go through their middle school and teen years. But this can be harder for girls with autism. I think that in many ways, if they are not moving through this stage and not taking better care of themselves as they move through these years, that can make them really stand out. And these are the kinds of things that we have to help girls with. So, for example, I have a young girl that I worked with in the past, and she is in her high school years now, and she always wears complete pink, pink shirts, pink pants, pink skirts, pink jackets, and after a while, this looks pretty odd. So I think that in this particular situation, girls may need more help with this. Sometimes it's easier to just dress up a kid, a boy, in sweatpants and a sweatshirt. It all works. Girls are going to need more help with that. Another area that is really different for girls and boys on the spectrum is, or girls and boys in general, that can be an area of real vulnerability for girls, is privacy. So girls typically do a lot of telling of secrets. There's a lot of confidentiality going on in relationships between girls as they get older through development. And this can be hard for girls on the spectrum to understand. There's a lot of, as I'm sure you know, if you're the parent of a girl on the spectrum or a girl in general, there's a lot of texting, there's a lot of phone calls, there's Facebook and Snapchat and all these different kinds of social media mechanisms. And girls with autism spectrum disorders need a lot of very explicit teaching about how to use these media applications and how to communicate with other girls in a way that's appropriate. I think it's hard. These kinds of issues are often implicit, and girls intuitively understand privacy issues as they get older. Not so for young women on the spectrum, so they are going to need more help than that with that. It's also the case, as I alluded to earlier, that as girls develop, again, preteen years into the teenage years, the way that they often establish friendships is by discussing emotions and interpersonal relationships. For boys and men, friendships are organized through a focus on activity-related or interest-related themes. So for girls on the spectrum, it can be very confusing to try to relate to other girls because they aren't always up to speed in terms of understanding their own emotions or up to speed on understanding why other girls would care to discuss feelings or interpersonal relationships. So if you have a typically developing daughter or a daughter in the spectrum, sometimes there's a lot of discussion in school about who likes who and who's mad at who and this kind of thing. And for girls on the spectrum, this can be very hard to understand. And it's hard to establish relationships if you aren't up to speed on how to converse, how to be fluent in this kind of thing. Girls on the spectrum often need to learn through explicit teaching how to maintain appropriate boundaries with regard to their thoughts and feelings, how to stay connected socially to other girls that they want to remain friends with. Sometimes I've met with teenage girls who want to be friends with other girls, but they don't respond when another girl texts them. So it's hard, and they sort of aren't understanding, like, why is that a problem? Why is this friend not responding to me? And it's because they, in fact, they didn't maintain the connection. A lot of times, typically developing girls, as they develop, they learn how to understand boys and men and how to relate to them, because relating to the opposite sex is different than relating to your same-sex peers. And this is something that often has to be taught very explicitly to girls on the autism spectrum. And then learning how to relate to parents and other adults and understanding display rules and how those impact their ability to communicate with other people. So I find that in the girls with autism that I work with, again, it's very important to be explicit about things like physical distance and boundaries, emotional distance and boundaries. What is reasonable to expect from a friend and what is unreasonable to expect? Sometimes there needs to be, as I just mentioned, explicit teaching about how to use pleasantries to establish connections, how to be reciprocal in conversation, to maintain a reciprocal conversation, to keep it going, how to recognize nonverbal cues and interpret facial expressions, and to also have guidelines for online media or any kind of electronics so that there's safety. I think that girls in the spectrum, all kids on the spectrum, but girls in the spectrum in particular need to understand the dangers of cyberbullying. I have had the experience of girls who have been bullied very, very extensively and have not been able to extract themselves from that relationship. And I think that's important. I think you're online and you're trying desperately to make connections with other people, you might be vulnerable to bullying. Another issue is same-sex friendships. So one of the things that are important, again, I actually covered most of this, but I think that what I want to describe is the importance of educating girls around relational aggression. And I don't know if people are familiar with that, but sometimes with boys, if there's a dispute among school-age boys or whatever age boys, there might be some tussling, there might be some rough and tumble, but then it's over and that's the end of it. Girls aggress against other girls in very, very subtle ways. excluding a girl from conversation, not including a girl in plans that you're making, letting a girl know that you're not going to talk to them or you're not going to share secrets with them. There are a lot of very subtle ways that girls and women, typically developing girls and women, show aggression towards other girls and women. And this can be hard for a girl with autism to recognize because it is so subtle. So I think that if a girl with autism is struggling in a relationship, it's often helpful for a parent, an educator, or a therapist to really take apart how the relationship is going in terms of very, very specific behaviors. Because if you do that, you might find that your girl with autism is really the victim of aggression, and she's not realizing it. Educating her about what that looks like and how to extract themselves from that interaction is really important. I think the other thing that is important to talk about and to think about is intimate relationships. So most of I would say the majority of young women that I've worked with in their teen years are very, very interested in developing intimate relationships, but don't know how to go about that. And that is something that is not coming to them intuitively, nor do they have peers to discuss it with. So typically developing teenage girls can talk with their friends about all these issues: sexuality, intimacy, values, boundaries, behavior. Often a teenage girl with autism doesn't have other girls to talk with about this. So this kind of information is really going to have to be presented very explicitly, and or educators or parents might be able to figure out how to provide some peer feedback for these kinds of issues, because they're very private issues, but girls do want to talk about them. And I put a book up here on the screen that I found very, very helpful, Girls Growing Up on the Autism Spectrum, What Parents and Professionals Should Know, by Shauna Nichols and her colleagues. I think this is the second edition, but I found that book really helpful in terms of thinking about girls and, what they need to know. And then I think the other piece here that I want to mention is that there's so much in the media now about intimate relationships, and sometimes girls on the spectrum really need a lot of guidance and discussion with regard to what they see in movies, on television shows, and on YouTube or on the media, because it can be very confusing to sort that out for any girl, but particularly for our girls. I think for educational settings, particularly higher education, one of the things that I think has been most tough for the girls that I've worked with is not the coursework in a college setting, but really understanding the social relationships that need to happen in a college setting, understanding how to relate to professors, how you need to advocate for yourself with a professor, the ways in which you need to communicate with other students if you're asked to work in a group, and understanding how to even behave in a dorm if you're in a college setting. All these things need to be taught explicitly, and of course, for girls in a college setting, safety issues have to be really explicitly taught and emphasized. I also want to describe a little bit about work settings and soft skills. So there has been some research on men and women on the spectrum in terms of who is able to obtain a job and maintain a job. And the findings have been that while girls, both men and women with autism spectrum disorders are equally able to get jobs, and I wouldn't say this is the majority, but of those who can get jobs, men are more likely to be retained in the work setting, and women are more likely to be let go or to leave the work setting. And there has been some speculation about why this is true. So some of the things that women and men need to learn, but women need to learn, is that you need to understand the rules of the employment setting and the relationship that needs to exist between you and your employer as a young woman with autism. Critically, it's really important to understand how developing positive relationships with coworkers is critically important for maintaining the job. So one hypothesis about why young women with autism have a hard time maintaining themselves in a job setting is, one hypothesis is that in any job setting, it might be the case that women are expected to be more social than men. Men who are not so social in a job may be given a pass and retained. Women who are not so social might be considered odd and might not be able to stay in the job. So that's something that women need to be really taught explicitly. I realize that I want to leave a lot of time for questions, so I'm going to speed up a little bit to see if I can get through some of this information. So self-soothing and self-regulation, a problem for both men and women on the spectrum. I think that the best way to address those kinds of difficulties, to reduce that kind of outbursts or upset, is to work on stress reduction. There's a lot of data now that suggests that the more individuals exercise, do yoga, meditate, the better able they'll be to reduce stress and not have outbursts, essentially. And John Rady's book that I put up here, Spark, describes the way exercise and yoga can help with children who are very little in terms of helping them control their behavior. I think when you're thinking about your own daughter in terms of socializing, it makes sense to think, what is your goal for your child? Along this continuum that I put on the slide, what do you think is what is your goal? I think you have to be very realistic about where you think your daughter could, how well do you think they can socialize? Do you think it's really going to be possible for them to socialize informally? Will they always need to socialize in formal groups like Girl Scouts or, karate, that kind of thing? Maybe they'll only learn to socialize with extended family and friends, and that's okay. Figuring out what your goal is and being realistic about it makes a lot of sense. I've put this slide up on common interest because I often think that for typical kids, sometimes we sign them up for things that they're interested in, and they form friendships with other kids based on what they like to do together. Often for kids on the spectrum, we group them together because they all have autism, rather than grouping them together with other kids who have their shared interests. So I find at my initiative at Yale, it makes a lot of sense to try to figure out what kinds of fun activities we can offer and then try to build relationships with other girls through those fun activities. These are strategies and supports that I think that you probably are familiar with if you have a child with autism, and I'm just going to review these. For visual strategies and supports, I don't think there's anything so specific to girls. I think that these kinds of things can be extremely helpful for grooming, dress, self-soothing, managing a schedule for both girls and boys. I think peer mentoring can be extremely important. I have found in my initiative here at Yale that when we include typically developing girls of the same age or slightly older, there can be a lot of interaction between all the kids in the group, both the girls with autism and also the typically developing kids. And it's clear that most kids listen to their peers more than they listen to adults. That's true for kids with autism and typical kids. So the more that you can engage typically developing kids to interact with your daughter in formal settings like school or in informal settings like at home, the better. I think schools possibly can be engaged in developing peer mentors. Another thing that I think is really important for teaching social behavior and conversation is doing narrative work, something that's effective for boys and girls or men and women. But essentially, especially for the littlest kids, taking digital photographs in particular context, providing a story along those lines to help a child understand what's happening socially, and then creating that narrative and building on it over time. This is a great way to explain the social world to your daughter. Video modeling is something that I think schools can learn to do. This is basically using videos that you can buy commercially or you can develop in the school that show kids how to talk to one another and how to communicate. I'm not going to be able to get into how this is done, but I think it's a really effective strategy that should be used more by schools. Direct instruction, I think, is a great way to work with girls, particularly on personal care objectives. So girls have to deal with a lot of personal hygiene issues that boys don't have to deal with, particularly as they enter puberty. This book, Taking Care of Myself by Mary Roble, is a great way to help girls understand the steps for taking care of themselves. And I think a lot of this has to be step-by-step instruction. And I think this is tough for schools. I think it's very tough for schools to do this kind of personal care for teenage girls, and this is something that families need to develop, but schools can certainly assist. Self-monitoring is also something that girls can be taught, helps them to develop better ways to take care of themselves and better ways to be independent. Again, I think that a lot of the strategies that I've suggested can be adapted for girls. I think it depends on your girl, and I think it depends on how you want to approach it and how you want to customize these kinds of interventions. So I'm going to end there by just thanking all the girls and women in my life who have helped me so much to understand all about girls and women and why they're special and why we should really attend to them. And I'm happy to take questions. Thank you so much for listening.
Thank you so much, Kathy. We got quite a bit of questions in, and we might not be able to get to all of them, but we'll recap them and we'll post them on our website. We'll post a list of Q&A. But let's get started with answering some right now. So we did get one emailed to us, and it's about someone that has a 19-month-old daughter, just wants to know how autism presents itself differently, and then your recommendations for therapy approaches, interventions, also just in general information about diagnosis since this is such a young girl.
So, actually some of the studies that have been done on toddlers in terms of how girls present differently have not shown that they present so differently in the toddler years. So without knowing your little girl, I would be hard-pressed to sort of identify specific ways that she might be different. But what I will say to you, at 19 months, she certainly can be evaluated and diagnosed with autism if that's appropriate. I don't know where you live, but at Yale we have a clinic for babies and toddlers. They see children under a year, and I can certainly forward that information to you if you're interested. I think you could get an individualized assessment and get a lot of recommendations for intervention.
Okay, great. Let's see. So can you just elaborate on some additional resources to help issues for girls with autism, maybe additional books that come top of mind, or someone asked specifically about video resources to teach girls with autism certain skills?
I wish I had come prepared with more details in terms of a book for girls on the spectrum. There are some books. I think there's one called Aspergirls, which I think is a really helpful book for young women on the spectrum, but also for parents to read. I believe the author is Rudy Simone. And for video modeling, I don't know specific resources for girls with regard to video modeling, But there is a series called Model Me Kids that is a commercially available video modeling, and it provides a lot of help with some of the things that school-age kids, and actually even preschoolers and school-age kids, skills they need to learn, things like making transitions, interacting with friends, that kind of thing. So that's one resource.
Okay. So a parent wonders how they can make sure that their daughter is appropriately reevaluated by the school system when evaluation techniques are more tailored for the signals seen in boys.
I think this is a tough one, because I think the question would be, how open would the district be learning more about girls on the spectrum and starting to think about the possibility that they are not picking up on some of the information that's available. I mean, the book that I referenced earlier, Girls and Women on the Spectrum, What Parents and Professionals Need to Learn. I think, if a school district was open to taking a look at a book like that, they might be more able to consider the issues in terms of the way your daughter presents. There's a fair amount of scientific literature out there about girls on the spectrum, but I think I'd have to perhaps gather a bibliography together and have that posted. I could even post it on my website as a way to help parents figure out how to educate their school. I think that's a tough one.
All right. How often do you see the overlap between sensory processing disorder and autism, and does this impact the presentation for a girl on the spectrum?
So for me, I certainly see lots of girls who have major issues of sensory sensitivities and sensory seeking. And actually what's so interesting now is that with the DSM-5, there is the criterion that some children might be hypo or hypersensitive to sensory input. So that's new with the DSM-5, and I'm glad it's in there. I don't usually make the diagnosis of sensory processing disorder, but we certainly see those difficulties in children who have a diagnosis of autism. If a child only has sensory issues and does not have any other features of autism spectrum disorder, then I think I would look for other, maybe another diagnosis would be more appropriate than autism spectrum disorder.
Okay. This is a tough question, and you might not have the answer, but maybe you can just give some recommendations. So someone wants to know when it would be a good time to tell their daughter who's high functioning that they're on the spectrum.
Yeah, that is a tough question, but it's a really good question. It comes up in our clinic all the time. What we have found is that for the most part in preschool and even sometimes in early elementary school years, and boys seem to not be so aware that they're so different. And from my point of view, it's usually a good idea to just leave that alone. What we recommend in our clinic is that when a girl starts to notice that there are differences in her behavior or differences in the way other girls relate to her, and she starts to think about that and get concerned about that might be the time to talk with her about her difficulties. And then based on her and cognitive ability, I think you want to think about how to frame it. So for a fourth grader or a fifth grader who is very cognitively able, you might say something like, people have different strengths and weaknesses. Some people are good at math. Some people are good at reading. Some people are better at being friends, and some people have a harder time, and that's one of the things you have a hard time with. But we're going to help you with that. Rather than using the label autism, I don't think there's any problem necessarily with using the label autism. I think you just have to figure out, at what level is my daughter? What is she ready to hear? Maybe the word autism is too much right now. Maybe it's better to frame it as social difficulties, and maybe later on it makes sense to say more about, autism.
Okay. I don't know if this is your expertise, but someone had a question if you could speak a little bit more about gender non-binary issues.
It isn't my expertise, but it's interesting because I was just reading about this last night with regard to biological differences between males and females. And, there does seem to be some overlap where there are more individuals who are dealing with this, the issue of gender identity or trying to figure out whether there is overlap. I think there are more spectrum girls with that issue, but I don't think there's been research on it, so I don't know what to say beyond it's something really worth thinking about and trying to figure out.
Okay. And then, so first, a question about how someone would get more involved in research at Yale for women on the spectrum, and then in general, do you have any recommendations about how people can get more involved? Of course, Spark is always a great opportunity, but any studies that you know that are recruiting for women specifically, and then also locally at Yale?
At Yale, we are super interested in recruiting girls and women for our research studies. We have, basically we have social cognitive neuroscience laboratories that are looking at eye tracking and EEG and MRI, brain functioning, behavior studies. We have intervention studies for children ages 4 to 7 with regard to autism. All these studies are looking for girls and women. So if you're local to Yale, or even if you're not and you can make a trip to Yale, we're really interested in talking with you. The person who is the clearinghouse for the studies at Yale is Erin McDonald, and it's ERIN.MCDONNELL@yale.edu. Erin would be happy to speak with any parent who wants to explore what possible research is available here. And then, of course, Spark is available to help people get involved in research.
All right. Do you have any recommendations to address issues of dating?
Oh, boy. Yeah. I do. I think this is the teenage girls with autism that I work with are very interested in dating. And I think that these girls just need a lot of very, very explicit information about how to form a intimate same-sex or opposite-sex relationship, what goes into the relationship in terms of kind of emotional sharing of interests, what goes into it in terms of physicality and sexuality. I think a lot of explicit guidelines and keeping lines of communication open so that girls can explore those relationships. And I guess, there is something that I wanted to add that I didn't include when I was speaking to my slide presentation, but I actually think that in terms of building relationships, friendships or intimate relationships, I think parents are best able to do this when they think about just building their daughter's network one friend at a time, starting off very slowly with sort of hand-picked companions who can relate to your daughter and are willing to relate to your daughter, and slowly building that network rather than, for example, having my daughter join ice skating lessons or join such and such lessons and hoping that they make friends. That can work too, having your daughter join Girl Scouts and seeing if that's going to work out. But I think building the network, thinking about building your daughter's network over time, taking the long view, and helping your daughter form some bonds. Okay, go ahead. Any further questions?
Yeah, you kind of spoke about this, but someone recognized that their daughter has an obsession for dress-up and repetitive pretend play. Would you recommend trying to control or limit this tendency, or do you have any sort of interventions that you'd recommend or that you feel a need for this kind of behavior?
You know what I would do? I would just try to figure out how to expand the play. So my guess, not knowing this child, but my guess is that this kind of repetitive dress-up pretend play is soothing and comforting and fun for this little girl. So rather than trying to control it or limit it or stop it, I would try to expand it. And she may resist because kids don't like their scripts messed with, but I would basically engage in the play with this child if they allow me to. And if they don't, then I would develop strategies, perhaps with a teacher, to how to push into a play sequence and to slowly expand that play sequence until your daughter is becomes more accustomed to more flexible play within the pretend play realm about dress up. Over time, you might be able to push the boundaries of her play so that she's more interested in allowing you to extend the play outward, and then she can develop more interest. It would be a process. I wouldn't do it abruptly. I would do it really gradually, but consistently and with persistence. That's my thought.
All right. So I think we're going to have to wrap it up here, but we're so appreciative of you joining us. You've provided a ton of valuable information. We'll